American Medicine Today, body dysmorphia affects over 2% of the U.S. population. Quick-fix cosmetic options are causing some men and women to suffer extreme consequences. We speak to Caleb Green, bodybuilder and social media influencer, who sheds light on this disorder. Then Jenna suffered from a pinched nerve in her lower spine, causing extreme pain in her daily life. After receiving the exclusive Bonati spine procedures, she is happy to be back to her active lifestyle pain-free. Finally, doctors are transplanting 3D bioprinted organs into donors with promising results. Dr. Bonati shares his thoughts on the current technology and where we will be headed in the near future. Could organ donation become a relic of the past? Find out coming up on American Medicine Today.
Featuring cutting-edge science and medical innovation, touching personal stories of recovery from pain, along with political, social, and healthcare issues plaguing our nation. This is American Medicine Today, brought to you by the Bonati Spine Institute and Alfred Bonati, MD.
Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Euchre and world-renowned orthopedic surgeon Dr. Alfred Bonati. Many people often think that body dysmorphia mainly affects women, just like anorexia or bulimia, but it's not often realized that it can also affect men just as commonly. Joining us to discuss is Caleb Big C Green, world-renowned fitness expert and bodybuilder, who tragically lost one of his best friends a few years ago to the effects of body dysmorphia. Thank you for joining us, Caleb.
Thank you very much for having me today.
This topic was kind of brought up to our attention after a Brazilian bodybuilder known as the Hulk died at age 55. Apparently, he had been injecting himself with some sort of oil to make the muscles look bigger. Can you tell us how common that is in the fitness world?
What he was doing is a very rare extreme. And he was actually injecting himself, from what we know, with a couple different types of oils, possibly even household cooking oils as well, too. There's a lot of rumors around about what he was doing. But obviously, when you're injecting anything of that nature into your body, there's going to be some sort of negative effect. But what is a lot more common is men trying to change their bodies to achieve a certain look. And there's so many different aspects to it. There's a lot of negative outcomes that can come along with it. Not so much to the extreme that he does, but it's a lot more prevalent than anybody even begins to realize through our society.
Injecting that oil does nothing to make you stronger. It just artificially inflates your muscles. Isn't that correct?
Yeah, you're literally just keeping the muscles in a state of inflammation and filling the muscle bellies up with oil. So around the muscle, you have what's called the muscle fascia, and that's literally just think of it like as a layer of film, and that creates the casement around the muscle fibers themselves and creates a shape. And you'll hear a lot of bodybuilders talking about trying to work for the pump. And that's because we're trying to stretch that fascia out to create more room for the muscle to fill in. When you stretch that fascia, the muscle goes, oh my gosh, there's extra room. And it's going to want to grow and fill that space in. So by injecting the muscles with oil, you're literally forcing that fascia to stretch. That does not mean that the muscle itself is actually going to grow.
Without knowing, you can inject directly on a vein or on the artery. And if you do that, you will have an embolism. And depending on the size of an embolism, you die.
Absolutely. That has been something that has happened before with bodybuilders that are using what's called synthol oil. That's the professional type oil that bodybuilders are known for actually using when competing on stage to enhance the look of their muscles. But synthol oil isn't something that you could use to the extent to create the extreme volume that the Hulk was using. But that is what we call a posing or pump and pose oil that more professional bodybuilders will use to enhance their body. And that has happened before more than once. Most of the time when you're injecting deep into a muscle, whether you're doing a intermuscular shot, there's not too many larger veins around there, but people have injected improperly and that has happened and people have died.
I understand body dysmorphia affects the brain and you try anything you can to get the image you want. But when they realize that they can have sudden death, you would think that that would caution them away from doing such a thing.
It's so rare, but and especially steroid use is what it comes down to. Steroid use is so prevalent throughout all of the Western culture. But the fact of that is so rare in our world, bodybuilding world. and just the fitness world itself, because the bodybuilding world is a very small niche compared to the hundreds and hundreds and millions of people and men and women that are trying to enhance their bodies just to look better throughout the world. That is a huge, huge market. So the chances of that happening is so rare compared to the amount of people that are doing it. It's not even an afterthought. No one is even thinking of it. I myself am on testosterone replacement therapy through my doctor. I work with Anti-Aging Associates out of Port Orange, Florida, Dr. Jason Shotel. I inject myself with my own hormones once a week, and it's not even a thought. I think when you're doing things to the extreme like he was, you're definitely increasing your odds of something tragic happening, like what happened with him and losing his life.
If you don't mind, I know it's probably a touchy subject, but if you could touch upon your friend that tragically passed a few years ago. Rich.
Yeah.
Mm-hmm.
Rich, many of us have suffered from body dysmorphia. I actually had a really bad accident and broke my arm. You can see the scar running up the entire back of my arm. And I went through a period of time where I was suffering from really bad depression, and it was due to the injury and the body dysmorphia. And I was experiencing it, and I know Rich had that same thing that many of us have. Many of us who have bodybuilded and worked very hard to change our physiques, we look in the mirror and it's never enough. It doesn't matter what we do, how much we shape our bodies, how lean we get, how big we get. We always see something imperfect. And I know Rich was the same as many of us. And he was just always trying to build a better version of himself. That's all we're trying to do, is just build our best selves. And sometimes it can be, the mental toll of it can be more than we realize.
At what point does it become dangerous?
I know from experience, okay? So we take someone and they're like, oh, I want to get some more muscle and lean up, a typical guy. So he does some steroids and he makes some progress. He's like, oh man, this is great. So then he does some more, and then he does some more, and then he does some more. And 5 years down the road, like me, he had an accident and now he can't do it. And he loses all that muscle. That image that he saw in the mirror of who he was, that became his identity. So to have your identity stripped away, it's very mentally damaging, because you don't even feel yourself. You don't even feel, you're not confident in yourself. I didn't even want to leave my house. I hardly left my house for a couple years when I went through my ordeal. I did as little as I possibly could, because it was just so frustrating, and it's very challenging. And I never even talked about it on social media. I tried to stay positive, but it definitely affected me, and it affects many people. So the question is, when you start abusing anything in any way, shape, or form, it's going to have negative effects. And everyone knows with a lot of performance enhancing drugs that when you come off those drugs, when your hormones come down, they have a negative rebound that affects your mental state. And depression is one of those issues that come along with drug abuse. So if you're having depression along with having your identity stripped away from you from an accident or just stopping that lifestyle quickly or whatnot, it can have a very negative and damaging effect to someone's mental ability. And depression, extreme depression, is what I have seen the worst in people and in myself, which we all know what depression can lead to.
Do any of these substances cause that depression?
Not really that I'm aware of. So all hormones are enhancers. If you're prone to depression, when you come off hormones and your body comes down, your hormones come down fast. Everything else is still way up here elevated, because as your hormones come up, taking drugs, your body elevates everything else to try to balance itself out. So then when you come off the hormones, everything else is up here. So your body trying to come back down, level out again, is a much harder process and a much slower process than you taking a pill, which is instantaneous, to get your body normalized again. And that's where the negative effects kick in. So I've seen people that are prone to depression come off steroids and drugs and experience more depression. I've seen people take drugs and have extreme acne. I've seen people take it, they've never had acne. It's all about what you're prone to. Same thing with anger. There's certain steroids that they say affect you up here. And I know people that have taken them and I've never seen a change. And I know people that have taken them and it's like they're not even the same person. They're so angry all the time. It's crazy. So I really think it has a lot to do with the person itself and how they react to the drugs they're taking.
Thank you so much for being on the program to discuss such a serious topic like body dysmorphia. Thank you so much, Caleb Big C Green, for being on the program.
Thanks, Caleb.
Appreciate you guys. Thank you very much.
Make sure you stay tuned. Coming up after the break, a story of recovery. Don't be screwed by lesser spine institutes who bait you with minimally invasive procedures, then switch to screws, rods, disc replacements, and hardware. At Bonati, no metal hardware fusions are ever used. Bonati invented the precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect 98.75% patient satisfaction. Over half our patients have suffered from failed back and neck surgeries at other facilities. Bonati succeeds where others fail. Jenna is an active mother of 2 that enjoys being outdoors and playing with her children. She dealt with pain for years that made it difficult to sit or stand and caused weakness in her leg.
I am married and I have 2 little boys, 7 and 15 months. We're a very active family. We love being outdoors. We love going to the gym as a family. I did start in the neurology department, and also I've worked in the clinic, so I've been hands-on in many different departments here.
Jenna learned about the Bonati spine procedures while working at the Institute.
My pain first started actually when I was a teenager. I've had low back issues just early on in life, and unfortunately the pain just escalated throughout the years. I did seek a lot of different treatment over the years, but in the last couple of years, my pain just completely affected my life. The pain previous to surgery was constant, mainly on the right side of my low back, and it did radiate up into the mid-back, especially while I was seated. When I would be standing mostly, I would feel a lot of weakness in my right leg. I had hip pain on my right side, right glute pain. It was just sharp, constant, burning. Pretty much every symptom that you could think of, I had on the right side. My pain affected my activities greatly. I am pretty stubborn, so I never completely stopped doing the things I loved. I would just unfortunately pay for it either that evening or the next day. But I would eliminate the gym quite a few days during the week, whereas normally I would go more often. But I did stop some of my gym activity. I did stop my running completely because I just couldn't do it anymore. My pain definitely stopped me from a lot of activities with my kids. I would find, especially with my 7-year-old, when he wanted to play on the floor, I would be playing, and then within a couple of minutes, the burning was so severe. I just felt so uncomfortable. I would constantly have to tell him that I needed a break and I needed to sit on the couch for a few minutes. And then, of course, I would go back to doing it just because I don't want to miss out being a mom, but it did affect every day.
Jenna, not wanting to endure traditional open back surgery because of the long recovery and infection risk, tried numerous conservative treatments first. When they didn't help, she decided that it was time for the exclusive Bonati spine procedures.
I've tried a lot of conservative treatment over the years. Actually, before I worked here, I was a massage therapist, so I was very big into doing massage therapy. So I had a lot of massages on my back. I've tried acupuncture, I've tried physical therapy. I've tried a number of things, TENS units, not big on medications, so I tried to avoid that. I did a lot of home stretches as well, gym activity, anything that I could do to try to avoid surgery. The remedies that I tried didn't really help me long term. It was very brief. It would just maybe get me through a couple of days, and then I was right back to square one. The point that made me realize that I needed surgery was after having my second child, my symptoms really became apparent. Every day I had pain. I had a new MRI, and it was very obvious that my problems were worse and that I needed to do something as soon as possible. But I am a planner, and I really wanted to wait until my kids were bigger. I didn't want to have to not lift my son, because obviously having a baby and being a mom, you want to be as active as you can with your children and be able to pick your baby up. But my MRI just really showed that I should do something as soon as possible.
Jenna scheduled an appointment with the clinic for an evaluation and had MRIs taken at our on-campus imaging center. This was to determine the exact cause of her symptoms and develop a personalized surgical plan to finally end her pain.
During my MRI review, they showed me that my L4-5 disc on the right had completely ruptured, and that really any therapy that I was trying before wasn't going to help me any further, and that I needed to move forward with surgery. So at that point, during that review, I decided I just need to do this. I'm going to do it next week, and that's exactly what I did. During the review, Dr. Bonati could tell me exactly where my pain was before I even said it. I've witnessed that on many occasions over the years where, patients are amazed that by just looking at the MRI alone, our surgeons know exactly where your pain pathway is. And that's exactly what they did to me too.
The exclusive Bonati spine procedures utilize conscious IV sedation, where the patient remains alert and able to interact with their surgeon. This technique ensures the source of their pain is eliminated before they leave the operating table.
My surgery day, I was actually really calm. I'm normally, anybody that knows me well knows that I can be an anxious person. And I walked in very calm. Working here for 10 years, I know a lot of the staff. I felt completely at ease. I knew I was in good hands. And I've never worked directly with the OR. I've known them over the years, but I've not worked in that department. And I was truly impressed with everyone was so professional. I felt so calm. Dr. Campoli was my anesthesiologist. She's amazing. I do remember communicating here and there with Dr. Bonati during surgery. I remember them asking me where I felt the pain at that current time, and I remember feeling comfortable.
After receiving the targeted Bonati spine procedures, patients are prescribed walking at least 40 minutes a day.
Walking is a huge part of the recovery process. That is what I can stress the most to existing patients or potential patients. You must move after surgery. Even the night of surgery, they advised me to walk up to 40 minutes that evening. If you need to break it up, that of course is fine, but you must move. And your body will tell you that you need to move too. I did notice that after I came back to work, that if I was seated for X amount of time, I needed to get up and do my walking, which I was able to do. But that is I would say, the biggest part of recovery.
Now pain-free, Jenna is back to enjoying time with her family, playing with her kids, and exercising.
A lot of the patients that I speak with on a daily basis tell me that their doctors at home feel that they can't be helped or that they can only be helped by fusion. I've seen over the 10 years of being here so many patients that were told that it was pretty much helpless, their case, or that they needed fusions. They're able to come here and have our surgeries and have success. I've seen patients come here that have had fusions and we're able to help them as well. So I always encourage people, go through our review process, get educated, see if we can help you with your specific case. My favorite part of my workday is seeing patients, honestly, before they leave. I get to speak with some people for months, weeks. I've spoken to people for a couple of years even before they've made that decision and commitment to come here. So sometimes you get so comfortable with these patients, and I love meeting them initially, but seeing them leave and seeing their happiness, seeing them possibly not have a wheelchair any longer or crutches or a walker is amazing. There's a few patients that just will forever be in my mind because they've done so well.
Jenna tells us her family has noticed the change in her as well.
I'm back at the gym full time. I get up before work while everyone's sleeping so that way I don't miss out on family time. I do my workouts, which consist of lifting weights and cardio. I'm really active. At home, I feel like I'm a better mom. At night when I get home, I'm able to play with my kids, not say that I need to have a break. My baby is very chubby and very heavy, and I find that I'm able to hold him and not have to say to my husband, please take him quickly, I feel like my back's gonna go out. I just feel strong and sturdy. I feel a huge change. And if my husband were here right now, he would tell you I no longer complain. At one point I had said, you know what, you're right. I actually am feeling really great. And I've been feeling great for quite a while.
Bonati was the one that helped me completely. Thank you for giving my career back to me. Several people have asked me, what did you do, where did you go, who did you see? And I'm more than happy to tell them that the Bonati Spine Institute is the place to go.
He said, don't tell me, I'm going to tell you what's wrong with you and tell me if I'm correct. And so he did.
The good news this time is it was not open back surgery.
They did give me my life back.
This scar is this big.
He was a doctor that didn't want to fillet my back open like a fish.
During the whole operation, I was awake. I was talking to the doctor. I saw the operation in the monitor.
He's not really cutting muscles, he's just pushing them away.
Immediately after the procedure, I was able to stand straight again, and I had zero pain.
Well, he did the surgery on the left side, and a week later, I was back in the gym.
When somebody can help you to where you can recover and where you can do the things that you were able to do before, you just become thankful.
I can't thank the Bonati Institute enough for giving me my life back.
It just opens up doors that you thought were closed.
I love you, Doc.
Welcome back to American Medicine Today. So, Dr. Bonati, what are some of the advancements that are being done in 3D bioprinting?
I believe the changes that we're going to have in medicine in the next 50 years are going to be enormous.
Okay.
One of the things that is coming now in experimentation, and they are very advanced, and they are predicting that in the next 10 years, they are going to be able to use this technique to practically create new organs. And when they're talking about new organs, these people are just crazy. They're gonna create new bladders, and they are already doing it in my university, in Wake Forest University in North Carolina. They are going to create new kidneys. They're going to create new hearts. And the only thing that they're not going to be able to create, because they're going to create also new lungs, but the day that they create new brains, that would be fantastic.
I could use a new one most of the time.
Well, let me tell you the point here.
Yes.
The kidney failure is one of the most important problems that we have in medicine, and kill people.
Right.
So if we can correct and do a replacement of kidneys that they don't affect a living donor, because there are only 6,000 donors, and you have 107,000 waiting for.
Right, and there's so much criteria as to whether or not that they could even be given a donor organ. So this could
because
save lives.
When you have an organ, you need to match everything.
Yes.
This new technique match from the beginning everything.
Right,
is your own organ.
How does it avoid rejection?
Cells.
So it's because they use their own?
Yeah, what they do is they use a technique. They take the cells from the patient and they seed those cells in a type of a system that is going to feed these cells. And then they create a system that is going to have not only the temperature, but at the same time the amount of vascularization in the area and the feeding type of a product that allows the cells to be the nutrition type for the cells.
Okay.
When all that happens, these cells start to grow. And when they start to grow, they start to have now sheets of these cells, and then they start to differentiate. And when the cells start to differentiate, then they start to produce the same type, because if you do the biopsy to see those cells, that they are kidney cells, they're going to produce a kidney.
Right.
So what happened is suddenly, and after the cells are all differentiated and start to produce a kidney, they're going to create by themselves vascularization, nerve structures, and everything that the cells need to be able to perform.
Yes.
And when you do that, you avoid immediately everything that is associated with the rejection that we have today. We are not going to be using steroids because it's not necessary. It's your same organ. Right. Then it's like for example, somebody is going to imagine you have an accident and then they take a piece of skin from your arm and they put it in your stomach because that's where the thing was open.
Correct.
Well, they don't need to give you cortisone or anything. It's just only take care that the thing heals well. That's all. But this is an enormous demand in the world.
It is.
Imagine that you have 6,000 donors for 107,000 people on the list.
Right.
That is going to be so powerful that it will force everybody not only to put more money in that research, but at the same time to try to finish that research as soon as possible.
Big Pharma is going to attack this at all cost because it will eat into their profits.
They believe that this bioprinting is going to make these bladders for less than $100,000.
Wow.
Okay. Well, but at the same time, yes, there's going to be opposition.
You know, I was watching different things where they were talking about 3D bioprinting in a matter of minutes, tracheas. They were talking about lungs being done in maybe 2 weeks, some other organs a couple months.
They can bioprint things in days.
Days to weeks to months.
Here they are saying around maybe 10 to 15 weeks. Now, still 10 to 15 weeks is nothing.
Yes,
okay?
Imagine these people are on wait lists sometimes years.
Yes. And the major trouble with how they support these people is enormously expensive. When they said that they are going to be very expensive, it's not so expensive if you compare the amount of money, just only the treatment of somebody who needs to be supporting the kidney with dialysis is around $500,000
Correct.
a year.
They were actually talking about bladders being made and then put into recipients.
They treat 2 or 3 children that they put down maybe 14 years ago, and those children, they saved their life.
Yes.
I am going to talk to Dr. Atala in Wake Forest, and I'm going to invite him to come over to discuss this. Yes. So if we can bring him over and tell us more, will be fantastic.
We'll talk more about this in future episodes. Thank you for watching American Medicine Today, and make sure you check us out next Saturday, 4 p.m. Eastern, right here on Newsmax. If you have any comments or questions, contact us at the number below. You can tweet at Dr. Bonati using hashtag American Medicine Today or hashtag AMT. We would like to hear from you.